most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heine, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Part of our assessment series, what is causing your shoulder pain? Frozen shoulder, how to tell.
Okay, then.
We've gone through all the other things that possibly could be a frozen shoulder.
Assessment series.
Right. Well, we were
For
going
the shoulder.
For the shoulder.
Okay,
right.
sure.
So when you have a frozen shoulder, the main symptoms are pain and stiffness with nearly all movements of the shoulder.
Sure.
That's the telltale sign. That's
Okay.
the gold standard.
What do you mean all movements?
Every movement, every direction. That's what the tests are going to be. And we can jump right into that,
Yeah,
Brad.
we'll break it down to a system.
So the first test, now you can do this standing, but stand in front of a mirror and you're going to check your non-involved shoulder first.
Good idea.
So let's say my shoulder problem is on my right side.
Mm-hmm.
So I check my left side. I see how far it goes up. Right.
That's pretty normal.
So the frozen shoulder, most often, it's not going to even hit parallel, which is right straight out like that. It's going to be like that or less when you compare it to the other arm. So this will be like this will be like that.
Typically painful or just feeling tight?
Painful, especially in the first stage, the
Okay.
freezing stage.
Okay.
It could also be an impingement, though, going this way yet.
Sure. Yep.
So that's why we're going to check another one. So this time we're going to raise out to the side. So thumb up. I'm going to raise up to the side. I'm going to go up as far as I can go. Are you able to go all the way up?
Well, I can go that high.
Okay.
I don't know.
And then I'm going to check with the other side. And the other side, again, is probably not going to go any farther past parallel.
Right.
It's
Thumb
gonna
up?
Thumb up.
Okay.
Right. So, and again, could be painful. The last one, you're going to bend your arms to 90 degrees like that. Yep. And you're going to go ahead and turn them out. Now, the non-involved one should go out quite far, but this one is not going to go out very far at all.
And keep note, the elbows stay close to the ribs. You don't let them go out like this. That's important for that particular test.
Yeah, if all three movements are affected, and you weren't having trouble with your shoulder before, it just kind of came on, then I think it's time to see the doctor and get it diagnosed. But I'm guessing you have a frozen shoulder. It's a pretty good sign.
Right. If it's shoulder impingement, this one will hurt and be limited. This one maybe too. And this one,
unlikely.
Not so much. It can be painful, but the frozen shoulder is more, it presents itself, I would say, more stiffness.
Right. Pain, though, I mean, especially at night. In fact, let's talk about this, Brad.
Okay.
So some of the signs, some of the commonalities among it, women greater than men, often between the age of 40 and 60.
Sure.
And I have to admit, the ones I've seen are almost fit right in this category, Brad.
Sure.
Increased risk if you have diabetes. So also, this is very common if you've had recent trauma.
Shoulder injury.
Yeah, shoulder injury or surgery.
Okay.
Especially if you had an arm fracture.
Right.
It definitely sets this process off. It's a weird thing, frozen shoulder.
Yeah.
It's really a strange thing because as we'll talk about in some of our videos, it tends to get better on its own, but it can take months, even years. Right. So I hate to discourage you, but
I don't even like to say the years because that depresses people.
Sure. And we'll show you some things to hopefully make it not years.
You know,
no, I was going to mention a couple other things, Brad.
Okay.
Do you want to say it first? Go ahead.
Well, I wanted to get back to, because it just crossed my mind, and it's like, really, if it is an impingement, this will hurt. But oftentimes, if you help with the other hand, once you get so far up, then it's better up here. And
that's a very good point, Brad. If you have a frozen shoulder, you get here, it's like you're hitting a wall.
Right.
It's not, you can't bring it up there very easy.
Right. And so that would help delineate whether it is an impingement if you have a question. This is actually, they call it painful arc syndrome because it's so common. Right in here, it's more painful, but if you help or sometimes you can reach through it and then it comes up and it's not so bad, then it's definitely not frozen
if you're hitting a wall, that means that capsule is tightened
Tight.
up on you and both ways and this way. It just doesn't want to move.
Yeah.
So also increased risk if you have heart disease, thyroid disease, Parkinson's. They're all tied to frozen shoulder. Definitely hard to sleep at night due to the pain. In fact, the last patient I saw is actually a person that works for us. He was having trouble sleeping. I mean,
laying on it or just in general?
just in general.
Okay.
It's just, it's going through that freezing process, inflammation. And I think when it's going through that, he got a cortisone shot and it did help.
So when he says freezing, that's just a term they came up with.
We'll be doing some videos, video describing the three phases.
Okay.
Freezing, frozen, and thawing.
Thawing.
Yeah.
Just
So,
like winter time.
just like winter.
There you go.
Like Frosty the Snowman. So, all right. Thanks everybody for watching.